All right, good evening, everyone. Welcome. I'm just gonna let everyone join and we'll get started here in a few minutes. Thanks. Alrighty then, let's get started tonight. Thank you so much for joining. My name is Joe Matessa. I am with Boston Scientific, and I'm here tonight with Dr. Rick Taylor from Central Ohio Urology Group and John Polson, one of our patient champions. Tonight we're here to talk about not just the relationship between diabetes and ED, but erectile dysfunction in general. And so we're going to do question and answer at the end. So a few housekeeping things. If you have any questions, please enter them into the chat. And at the end, I'll go ahead and facilitate a Q&A with Dr. Taylor and Mr. Paulson. And then hopefully you'll get all of your questions answered. So without any further ado, I'm going to pass it on to Dr. Rick Taylor. Thank you so much for joining us.
Good evening, everyone. Thank you so much for being with us this evening to learn about a topic that I know is important to all of you who are here with us on a very personal level, and obviously a passion of mine in terms of my medical practice and work. Just to say a couple of words about myself. I grew up here in Central Ohio, went to Columbus Public Schools, and after graduation, spent 4 years in Cleveland at Case Western Reserve University for undergraduate, came back to Ohio State for medical school, and then after 5 years of residency training in Chicago, came back home here to Columbus for practice. One of the things that we'll be talking about this evening is not only erectile dysfunction, but really advanced treatment options for erectile dysfunction. And so one of the things I think is important for guys to keep in mind this evening is that the docs that are best suited to treat erectile dysfunction are the docs that specialize in that treatment. That is to say, a urologist, and even more so, someone who specializes in this kind of approach. So I want to start this evening by talking a little bit about what is erectile dysfunction. You know, really the way that we define erectile dysfunction is the inability to achieve or maintain an erection for sexual activity, however we define what that is. And this is an incredibly common problem. In our world, we're taught that 50% of guys who are 50 years old are going to have some degree of erectile dysfunction, and 60% of guys who are 60, 70% of guys who are 70. But what we don't often talk about is that the numbers work in the other direction as well. 40% of guys who are 40, 30% of guys who are 30. I saw a few guys today in their late 20s and early 30s complaining of erectile dysfunction. So this is something that can impact us at any point in life. And as you might guess, because of how common it is, there's an incredibly large number of guys that suffer from erectile dysfunction. You know, the way that the process is kind of designed to work in a perfect world is that some form of sexual desire causes nerves up in our brain to fire. Those nerves send signals that travel down the spinal cord, ultimately telling the arteries that carry blood into the penis to dilate. And as the picture here shows, on the flaccid side, we can see that there are blood vessels there, and there's a small amount of blood flow that's coming to the erectile tissues. But as we can see in the erect picture, when those blood vessels dilate, the whole area kind of dilates and lots of blood rushes into the erectile bodies. As the erectile bodies fill with blood, they're limited by the tough tissue that holds the blood in the penis. And that's what allows for, in an ideal circumstance, that rigid erection, which in a perfect world is going to last until after ejaculation, when a separate set of signals tell the arteries to clamp down so that the erection goes away and we go back to the flaccid state. So it seems like magic when it happens, but it's actually a pretty complicated process. There are lots of different causes of erectile dysfunction and medical problems that might come along with the development of erectile dysfunction. As we can see in our little graph here, 40% of guys who have erectile dysfunction have what we would call vascular disease, which is just a fancy way of saying hardening of the arteries. So I think it's important to say that the same process that can lead to heart disease or peripheral vascular disease often starts many years earlier with erectile difficulty. So sometimes in my practice, I pick up some of these other medical problems at earlier ages because of ED kind of showing up as the first sign or symptom. Along with vascular or blood flow issues, diabetes is a common cause of erectile dysfunction because, unfortunately, diabetes has an impact on both the nerves that signal our arteries telling them to dilate and on the arteries themselves, to make it a more difficult problem to treat and a problem that tends to occur in guys who are even younger. About 15% of the time, erectile dysfunction happens because of stuff that we as physicians do, happens because of surgeries or procedures that we have done, or medications that we have prescribed. Kind of the classic medication that can cause erectile dysfunction is going to be a blood pressure medication. Now, it's very important to be on blood pressure medication if your doctor thinks that that's necessary to keep your blood pressure in the normal range. But it might lead to an underlying problem getting that much worse. And the reality is, of course, when I'm sitting across from a man who's sharing with me his erectile difficulties, the most common scenario is that we have a little bit of a number of these different things. Maybe we have diabetes and we're on medication for blood pressure. Maybe we had a heart attack a few years ago and we're on medications because of that. So it's very common that we might have multiple risk factors to cause ED. When we think about the relationship between erectile function and diabetes, we have to acknowledge that diabetes is, of course, not the only cause of erectile dysfunction. But in our country, diabetes is a very common medical problem. And unfortunately, for about half the guys that have diabetes, may lead to the development of erectile dysfunction. As you can see on the slide here, diabetes is an incredibly common problem. 15 million men in 2015. There's no question that when we repeat the census in a few years, that number is going to be much higher, just because we as a population are aging. And unfortunately, as we age, our risk of developing diabetes goes up. And the reason that this is so important for our conversation this evening, and for conversations that I have with guys in the office, is that guys who have diabetes are more difficult to treat from the standpoint of their ED. And that goes back to what we were talking about just a few minutes ago, about the fact that diabetes can have impact on our nerves as well as on our blood vessels. So it can be a more difficult problem to treat. In addition to that, the ED that guys with diabetes develop tends to be more severe and tends to show up earlier in life. We talked about those statistics. 50% of guys who are 50 developing ED, 60% of guys who are 60. Well, gosh, I had a guy in my office just the other day who's 27 who has ED to the point that pills are ineffective. And the only risk factor he has is that he has what used to be poorly controlled diabetes. So my point is, this can have a very major impact even at a very young age. And in some guys, ED is actually the presenting symptom of diabetes. In other words, one of the things that makes diabetes so difficult for us all is that it's a silent disease for most guys. If we're not getting regular blood work with our family doctors, it's a disease that may go unchecked for years and years because it doesn't cause us symptoms until it's very advanced. You know, when we think about the management of ED, and in the slides to come, we'll talk a lot about different treatment options. But most guys who are here with us this evening for the presentation have at least heard of medications like sildenafil and tadalafil. Those are the generic names for what used to be the brand name Viagra and Cialis type medications. Well, the way those medications work is that they require the nerve and artery communication to be intact. They require that the blood vessels are at least reasonably healthy in order to work. But if diabetes has led to the nerves not functioning as well as they used to, or if our arteries aren't dilating well despite the medications, the pills are unfortunately not going to be as effective for us. And that's typically what we see for guys with diabetes, is that medications, that is to say pills, don't work as well as they might work for guys who don't have diabetes. And this is just part of the conversation that we have in the office, as I'm trying to figure out with each individual guy, what's the best treatment option for him based on where he is in his journey. Like with a lot of things, the older we get, the worse things get. And unfortunately, that, as I'm sure a lot of guys can tell me better than I can tell them, is just a fact of life. So whether we have diabetes or not, unfortunately, the older we are, the more likely we are to have erectile dysfunction. But specific to diabetes, the duration of time, how long have we had the disease, and how well have we controlled the sugar levels? Are we somebody whose sugar gets up to 300 or 400 all the time, or whose hemoglobin A1C levels are higher than 10 or 12? If we're really not doing a great job controlling our sugars, well, that's going to unfortunately lead to worsening ED. As I mentioned a few slides ago, it's very common for guys to have multiple problems. We probably don't just have diabetes. That's enough, don't get me wrong, but we probably have diabetes, and we may have a little bit of high blood pressure, or a little bit of heart disease, or we're on medication like diuretics that decrease blood pressure by helping us get rid of excess fluid. All of these things together just make the ED that much worse. So what do we do about all of this? I think it's important to say that this slide actually in a lot of ways is one of the most important slides in this entire presentation, because literally every time that I talk to a man in the office these days about erectile dysfunction, whether it's a man that I'm meeting for the first time or somebody that I've been taking care of for over a decade, he's going to ask me about shockwave therapy for erectile dysfunction or platelet-rich plasma or stem cell therapy. And the short answer to all of these things is that they are exciting, but not ready for prime time. And that's, I think, an important thing to know, particularly here in Central Ohio. If you're listening to sports talk radio or you're watching the football or basketball Buckeyes, you're gonna see commercials for shockwave therapy for erectile dysfunction. They call it linear compression therapy. There's a number of different names for this. There is some relatively minor science behind it, okay? So there is some data to show that shockwave treatments do improve blood flow. But what they don't tell you is that those studies also say only 60% of guys have any response at all. And even if we see a little bit of benefit, it only lasts for a year. Most places that are doing these treatments charge guys a lot of money, $2,500, even $3,000 to undergo the treatments. And forgive me for putting it this way, but I don't think the bang is worth the buck on this particular approach. Similarly, stem cells. Stem cells are very exciting. I mean, it just stands to reason. If we can inject medication into the penis and cause healthy and new blood vessels to grow, well, that ought to fix our ED problems. And that totally makes sense. But the science hasn't caught up with the excitement. In other words, it doesn't work the way that we hoped and expected it would. Platelet-rich plasma doesn't work at all. And if anybody recommends that for you, I would strongly encourage you to get up and leave, because that has been shown to be not effective at all. So what are some treatment options that folks may be familiar with, but some things that we know are effective? Well, we'll talk in all of these things about all of these things in a lot of detail. Of course, we'll talk about oral medications, that is to say the pills for erectile dysfunction. We'll talk about delivering medication directly to the erectile bodies of the penis via an injection or a pellet that's placed in the tip of the penis. We'll talk about mechanical solutions for erectile dysfunction, such as the vacuum pump and the penile implant, which is really the only restorative option as far as treatment of erectile dysfunction. So medications like Viagra, Cialis come under the umbrella of what are called PDE5 inhibitors. They are so named just because of the particular enzyme, the particular protein that they work on in the body. And the way these medications work is by causing the signals that our nerves release to tell the arteries to dilate. These pills cause those signals to hang around longer so that we get more signaling to the arteries for better blood vessel dilation. And although these medications can be effective, particularly if we take them early on in the ED process, that is to say, if I'm sitting across from a guy in the office and he says, I can get an erection, it's not great, but we make do and we can still have intercourse and everything is okay, but I'm not quite where I want to be. That's a guy who may benefit from a pill. If I'm talking to a guy and he says, I haven't had an erection in 10 years, doc, I have to say the duration of the disease means that the pills are going to be a little less likely to be effective. And the other thing that's important to say is that over the long haul, the pills are not effective for more than a few years for most guys. This PDE5 enzyme that I mentioned exists in other parts of the body. And so we might have some side effects from taking the medication. Common side effects can include headache, facial flushing, nasal stuffiness. Some guys get acid reflux and muscle aches. Some guys get vision changes. We can even get a little blue tint to the vision. Met a guy today who I've never met before who had this very rare side effect, but it's a real thing that can happen, and that is hearing loss. After a couple of doses of one of these medications, he developed temporary hearing loss, but obviously a very scary thing for him. So we have to take some caution when we take these medications. We know that we can't safely take these medications if we're also taking nitrates for chest pain. If we have the nitroglycerin spray or tablets that we put under our tongue for chest pain, we can't safely use that around the same time that we would use one of these medications. And we have to also be cautious about starting one of these medications the same time that we start blood pressure pills, for example, or other things that can lower the blood pressure, because that might cause more dizziness. Well, if taking a pill is not effective, it stands to reason that if we could deliver medication directly to where we want it to work, that it might be more effective. And that's the idea behind injection therapy. Of all the medications that we'll talk about this evening and all the medications that exist for treatment of ED, injection therapy has been around the longest. It was actually developed almost 50 years ago in the 1970s. The way it works is a very, very small needle is placed in the side of the shaft, and a small volume of medication is injected that dilate the blood vessels much more effectively than the pills. The advantage of an injection approach is that we don't have to have nerve signaling that works in order for the injection to work. So in my practice, guys that perform injection therapy successfully are guys with potentially with diabetes, or potentially with spinal cord issues, or other things that can cause the nerves to not function as well as they would otherwise. Of course, injection therapy can be very successful for any man with erectile dysfunction if he is so motivated to give that a try. Common side effects of injection therapy. Well, obviously sticking ourselves in a sensitive part of the body with a needle is not something anybody particularly looks forward to. So there can be a little discomfort. There can be some bruising potentially if we hit one of the veins in the skin. And those are probably the most common reasons that guys would stop the injection therapy. I think it's worth saying also that some guys get some pain with the erection that they achieve with injection therapy, just because of the way that the medication works and the way that the tissues are stretched. So those are common reasons why guys might stop. The injection therapy is also one place where it is possible to sort of overdose on the medication. That is to say, if we give ourselves too much medication, we might end up with an erection that lasts longer than 4 hours, which sounds amazing until it actually happens. And then it hurts like a son of a gun. You have to come and see a guy like me. Typically, those types of things happen around 3 o'clock in the morning as well. So it's very pleasant for all involved. So that is something else that we teach guys how to avoid that from occurring. Vacuum erection device is a great mechanical option to treat ED. If the medications are not as effective as we'd like, or if we're looking for a non-medication solution, vacuum erection device is essentially a plastic cylinder with a little rubber gasket that's placed over the penis. A hand pump or battery-powered pump causes negative pressure to draw blood into the penis, which is trapped in place with a constricting band that's placed down at the base of the penis. The advantage of the vacuum device, again, is that there's no needles, medications, procedures involved. The downside of the vacuum device is that some guys find it uncomfortable to use. And I mean that in a number of different ways. It can be physically painful to kind of have that negative pressure drawing blood into the penis. There can be some bruising of the skin that can be painful during intercourse. Also, we're saying that it can be cumbersome to use. It's a little bit awkward to take several minutes to sort of inflate the penis with the vacuum device. So that's, of course, a very individual thing, but that's a complaint and concern that I've heard from many of my patients. That band that we place down at the base of the penis to hold the blood in place, well, it tends to also obstruct the urethra tube, which is the tube through which we urinate and also the tube through which we ejaculate. So if we have that constricting band in place, we would expect to have no ejaculation. We still have the sensation of orgasm, but there wouldn't be any fluid that comes out because it's blocked by that essentially rubber band there at the base. Urethral suppository is going to be another way of delivering medication directly to where we want it to work. And with a urethral suppository, essentially what we do is place a little applicator in the tip of the penis. Through that applicator, we slide a small pellet into the urethra tube. We then remove the applicator and, guys, massage the penis, which causes that pellet to break down and be absorbed by the erectile tissues. So the advantage of a urethral suppository, again, there's no needles involved, although you might make a reasonable argument that placing an applicator in the tip of the penis is probably just as uncomfortable as sticking a needle in the side of the shaft, and that's probably true. The real advantage of a urethral suppository is that it does not need to be kept cold. One of the things I didn't mention about injection therapy is that the medication needs to be kept cold in order to maintain its shelf life. And so for guys who travel a lot, or guys who are going to be going camping for a weekend or something like that, where they may not have the ability to keep the medication as cold as they would like, a urethral suppository can be a reasonable alternative. I've prescribed urethral suppositories, of course, a number of times over the years. What I have found these days is that, number one, they're a little bit difficult to acquire. That is to say, pharmacies tend to not have them as commonly as they used to. I think because in general, the usage of these medications has gradually gone down over the years because they just don't work quite as well as some of the other things that we've already talked about and will talk about this evening. So the penile implant is, as I mentioned at the beginning of the presentation, the only restorative option for erectile dysfunction. And the reason that I frame it that way is that once a penile implant has been placed, once it's in the body, once we've healed from the procedure, and once we know how to operate the implant, it's going to behave most commonly like our normal erectile function does or did, because it's going to work every time for us consistently to provide the rigid erection that we're looking for, that's going to last as long as we want it to last. And essentially the way that this works is in a procedure that we do in the operating room that takes about 45 minutes or so, we make an opening in the skin, either the low part of the belly, or in some cases, we make a small opening in the skin of the scrotum. And through that opening, we pass cylinders into the erectile bodies of the penis. One cylinder goes on each side of the shaft of the penis. Those cylinders, rather, are connected by some tubing to a pump that goes in the scrotum, in between the two testicles, where we can easily feel it through the skin there. And then a separate tube connects the pump to a reservoir that goes in the pelvis, kind of in the groin area where we can't feel it. At rest, that reservoir is filled with sterile saline or saltwater solution, and the penis is soft and flaccid, looks, appears, feels totally normal. When we want to achieve the erection, what we do is simply squeeze this pump, which we can feel through the skin of the scrotum. That moves fluid from the reservoir into the cylinders, which become rigid for the erection to occur. The erection is going to last as long as we want, because the only thing that tells it to go away is a little release valve, which is part of the pump. And when we squeeze the release valve, that causes the fluid to go backwards and into the reservoir. When we think about the effectiveness of a penile implant, what I tell guys in office consultation and on the day of the procedure is that I'm going to test the implant several times before and during and immediately following the procedure to make sure that it's going to inflate and deflate the way that we want it to. In other words, that it's going to provide a successful result. So as far as how effective it is, it approaches 100% because nobody's going to leave the operating room until I know that the implant is going to be effective. Overall, the long-term success rates and satisfaction rates, I should say, are also very high. Greater than 95% of men, greater than 90% of their partners are happy with the results with a penile implant. The most common side effects and complications, well, are really, quite frankly, related to the fact that we're making an opening in the skin in order to place the implant. So anytime we make an opening in the skin, there are going to be risks of bleeding and infection. Bleeding risk with this procedure is extraordinarily low, extraordinarily rare for us to have any kind of serious bleeding, but it's very common for guys to have some bruising and swelling of the tissues for a week or two after the procedure. The infection risk is also extraordinarily low at about 0.5%. And one of the reasons that we commonly would choose the Boston Scientific implant is that it's coated with antibiotics to further decrease the risk of infection at the time of the operation. We also have to talk about something called erosion. Erosion is the idea that some element of the implant may kind of end up in a tissue area or a position that is different than the one that we placed it. Now, this is not the kind of thing where a portion of the implant can go any place outside of the area where I place it. But for some men, particularly actually for guys who have diabetes that is not well controlled, sometimes, for example, some of that tubing could potentially erode through the skin. And the way that we avoid that is by staying very much on top of the situation, seeing guys back regularly. This is an extraordinarily rare occurrence. In 12 years of doing this, I can say in confidence, I've had one patient that has had this kind of an issue, and I'm well over 1,000 implants at this point in my career. But it is something that we have to say out loud can occur. The other thing that can occur much more commonly is that the device has a certain lifespan. Typically, we would expect a penile implant to last about 10 years or so. Some guys get 12, 15. The longest record that I've observed is a guy who got 19 years out of his implant, and dare I say, with regular use as well. But typically, the lifespan is about 10 years or so. And if we develop a mechanical failure of the penile implant, really what that means is that some of the fluid that powers the system has leaked out to the point that when we squeeze the pump, essentially nothing happens. Well, this is not a dangerous situation for guys at all. And if guys are comfortable with being done with sexual activity at that point in their lives, we can simply leave the non-functioning implant in place and it doesn't cause us any problems. If we want to continue with sexual activity, we would have to go back to the operating room, remove the old implant and place a new implant. But that procedure is very safe and commonly performed as well. When we think about the different types of penile implants, what I've really discussed here previously, and the implant that we use most commonly in the United States, is the three-piece inflatable prosthesis. That's the one I referenced that has 2 cylinders, a pump, and a reservoir. There is also a 2-piece inflatable prosthesis where instead of having a reservoir, some of the fluid is actually stored in the back half of the cylinders themselves. And there's also a malleable penile implant, which is a great option for guys who don't have as much hand strength or perhaps have had injuries to their hands or have a neurologic condition that might make it difficult to squeeze the pump. With a malleable implant, the penis simply remains the same length and rigidity, but the implant is bendable. So it bends down for every day, it bends up for sexual activity. And that can be a great option for guys, again, for whom the pump is not a great solution. As I mentioned earlier, the 3-piece, what's called inhibizone coated implant is the most implanted prosthesis in the United States and, of course, in the world. and the only one with a built-in antibiotic coating that, again, further reduces the likelihood of infection. In my own practice, because this is a procedure that I specialize in, I'm commonly sent patients who have had implants from urologists elsewhere that have not gone well, problems where the implant was placed incorrectly, or in some cases, situations where the implant has unfortunately become infected. And when I perform a revision surgery to essentially fix the problem, it is the inhibisone coated implant that is my go-to, because I know that's going to keep our repeat infection rates as low as humanly possible. And it really works phenomenally well for that. This is a little illustration that kind of goes through, a little cartoon that goes through the mechanism of the inflatable implant here. So in just a moment here, we're going to see kind of a schematic of what the implant would look like inside the body with the cylinders, the pump, and the reservoir. Here we're squeezing the pump, which moves fluid from the reservoir into the cylinders, which become rigid for the erection to occur. And when we're ready for the erection to be done, we simply squeeze this release valve, which is easily felt and which is part of the pump. And that causes the fluid to go backwards into the reservoir, and we go back to the flaccid state. This is going to be a demonstration, obviously in an actual patient circumstance, not one of my patients, but of Dr. Cartman, who is also a high volume penile implant surgeon. And so here we can see the gentleman squeezing the pump, which he can feel through the skin of the scrotum there. We're getting a little lag on the video here, but you can see that as he squeezes the pump, the cylinders are filling, the erection is occurring there. Again, you can see it just takes a few squeezes to inflate the implant. Great result there. And then when he wants to deflate the implant, again, he's simply squeezing that release valve felt through the skin to allow for the implant to deflate. And one of the take homes here, I hope that guys can see, is that unless we were having this conversation about an implant, and unless I told you what this man was doing with squeezing the scrotum in a certain way, you would have no idea what in the world he was doing, because the implant is completely concealed within the body. Nobody knows that it's there unless you want them to know. In terms of what to expect for the procedure, we perform this operation either as an outpatient or with a one-night stay, or what's called a 23-hour observation kind of a circumstance. And I give guys the choice. Whatever they prefer to do is totally fine with me. In my personal practice, I haven't seen any change in outcomes, no change in infection risk or anything like that, whether guys go home the same day or spend one night in the facility. Again, we make a small opening that's about an inch or so in size, just above where the penis hits the belly or on the scrotum itself. I do generally tell guys to take it easy for about a week or so, and it's about a week that guys tend to take off of work. In a perfect world, I think it's great if guys can take 2 weeks off just to really kind of get that healing done before we go back. But the most common scenario for my own patients is that they go back to work 1 week after the procedure. And generally it's about 4 to 6 weeks or so. About 4 weeks, we're back in the office learning how to use the implant, showing guys how to inflate and deflate, and then with the green light to proceed with sexual activity at any point going forward. very understandably, the last question that guys always ask me in the office, and the last just about slide that we have here is about cost and insurance coverage. And fortunately, it's generally very good news. Most insurance companies and Medicare do cover the implant procedure. And certainly part of our process is to perform a prior authorization, or in the case of Medicare, what's called a predetermination, to make sure that the coverage is there for the implant, and that we don't get any surprises. But generally very, very well covered by insurance, which is in contradiction to coverage for other treatments. Medicare does not cover the pills very well. They do not cover the injections very well. They no longer cover the vacuum pump, but they do cover the penile implant procedure. So I'd like to take this moment to sort of pause my comments. Obviously, I'm still going to be along with everyone this evening and available to answer questions later on. But I'd like to turn it over to John Poulsen, who is kind enough to join us this evening to talk a little bit about his experience with the implant procedure.
Well, thank you, Dr. Taylor. I'd like to welcome everybody who's on the Zoom and those who are joining us by phone. I like to call myself an ED survivor because I went through this over 20 years ago, and my issue started back in 1997, and I was diagnosed as a diabetic, and I had high blood pressure. At the time, I was on active duty, and I had to take a physical because I was about to be transferred to an aircraft carrier. So when I got my diagnosis, that transfer was canceled. And, they told me at the time, watch what you eat, exercise. They told me about the complications, or have a limb amputated, or you could go blind. But at the time, they weren't really talking about erectile dysfunction. So a couple of years later, all of a sudden, I started having those issues. And it was during the time of the intercourse where all of a sudden, I just started losing my erection. And, first I thought, well, maybe it was because I was exerting myself and I was sweating kind of heavy. But then after a couple of times of getting an erection, but when I went for penetration, I just lost my erection. And so at this time, my wife had a couple of questions to ask me. Her first question she asked was she still desirable to me? And, my answer was yes. And then she asked me another question. She says, well, honey, are you having an affair? And by this time, I was starting to get kind of irritated because I'm like, I'm with you most of the time. So no, I'm not having an affair. And then she came up with the mother of all questions. And she said, well, honey, be honest with me. She said, are you gay? And no offense to anybody who's with that lifestyle, but by then I was really upset. I was like, no, I'm not. So, as a man, I'm trying to correct this situation on my own. So, one day I was at work and I was looking in the paper, this ad in the Atlanta Journal. And by the way, I'm bringing you greetings from Atlanta, Georgia. This ad says, well, we treat erectile dysfunction. So I called this number, made an appointment. And so they took my blood pressure and they said, well, Mr. Poulsen, your blood pressure is still too high. And they took a Doppler sound. And they said, well, you're getting some blood flow, but your blood pressure is too high. So, come back in 30 days. I said, okay. 30 days went by and I go back and they took my blood pressure again. They said, oh, your blood pressure is within normal range. and we can start you on your treatment. So I was like, okay, well, what is that? And he says, well, they started me off with Viagra. And at the time it was the 50 milligram tab. So I said, oh, great. Of course, they only gave me 6 tablets, but hey. So first couple of times I used the tablets and they worked like a charm. I was like, oh, feeling great. Got my life back. Then I started using them again, and all of a sudden they just weren't effective. So I went to this place and I says, hey, what else you have? Because the little blue pill is not working. So what else is there? Well, then the little brown pill, Levitra. So I said, okay, and use that the first couple of times and worked like a champ. Felt like a man again. Then all of a sudden it just wasn't effective. Now, to anybody that has erectile dysfunction and are using the pills, and if they work, great. Don't stop what you're doing. So I went back to this place and I said, well, doctor, the little brown pill doesn't work, then what else is there? And so they gave me Cialis, which just came on the scene. Well, that did nothing for me because I was taking that stuff like it was candy. And every time I seen that commercial with that couple with sitting in the bathtub holding hands, oh, I wanted to just reach through my television, pull the guy out and punch his lights out, because it was almost like he was mocking me, because that did nothing for me. So I went back to this place and I said, well, doctor, now I'm calling all 3 of these pills, I'm calling them the 3 Stooges, because they didn't work. So I said, well, the 3 Stooges don't work. What else is there? Then they gave me the vacuum pump. So I said, hey, okay, well, I'll try this. Well, I don't know how much it costs today, but back then it cost me $200. And they gave me a video, like the video that we just seen with the man pumping his penis up. So I went home and my wife and I are sitting there looking at this penis on my TV screen, and I'm trying to pump myself up, and it did nothing for me. A couple of times I was able to get the band on, and it hurt. Now, if there's anybody using the vacuum and if it works, don't stop what you're doing. But it just wasn't effective for me. So I started things, so I'm like, how does everybody know what's going on with me? Is my wife putting my business out there in the street? I was getting things in the mail, herbal things, remedies. I was trying Vigor RX, Penegra, Korean ginseng, herbal erotica for men, Erectinol. You name it, I was trying. And so I had my urologist had referred me to one of the hospitals here in the Atlanta area. And so when I went there, and so I'm laying on this table. So the guy tells me, he says, don't think about anything. And so I'm laying, looking up at the ceiling. Next thing I know, I feel this little prick in my penis. And he says, okay, you put your pants on and you can leave. So I'm like, okay. So I'm driving home on highway or Interstate 85. Now, if anybody's ever been through Atlanta, you know how the traffic is horrendous. And I had to go to the bathroom. And all of a sudden, while I'm driving, I just happened to feel the stirring down there, and I'm getting an erection. So I'm like, okay, I got to go to the bathroom. I'm in a highway, I got an erection. So I had to pull off of the road, and I stopped at one of the malls. And then I was kind of like fearful, because I'm like, what if there's some little kids out there and see me running around with this erection in my pants? So I'm like, after about 5 hours, I still had an erection, and it hurt. As Dr. Taylor was saying, yeah, those things hurt. So I had to call my regular urologist, and he had to take the erection down. And needless to say, I was like, oh, great. So the next thing I started, my urologist recommended me to was the Muse. And I think I only tried that for 15 seconds because don't stop what you're doing. But it did not work for me. So one day I'm driving to work and I hear this advertisement on the radio: we treat erectile dysfunction with no surgery. So I'm trying to write down the phone number. Now I'm left-handed and I'm trying to write right-handed while I'm driving. Thank God there was no traffic around me as I'm trying to write this number down. So I get to my job, I call this number and I make this appointment. So I'm sitting in this like 2x4 room and I'm looking at all these pamphlets that they had there. They had the Viagra, Levitra, Cialis, the vacuum, Muse, and then they had this pamphlet on the penile implant. So I said, well, when the doctor came in, I said, hey, doctor, I'm kind of interested in this penile implant. And he says, no, you don't want that. So I'm like, my question was, well, why don't I want it if you have a pamphlet here? He says, well, what they do is they slice your penis open and you'll be disfigured for life. I said, well, that works for me. I don't need that. So this place started me on the injection method. And so they told me, well, you can only have sex 3 times a week. So I said, well, doctor, what happens if I want to have sex 4 times a week, 5 times a week, 6 times a week, 6 times a day? He says, not a problem. You can have it as many times as you want, but when that serum runs out, you have to wait for 2 months and then before you get a refill. And unfortunately, my insurance didn't cover it. So at the time I was paying $400 per serum. And as Dr. Taylor said, I had to have that refrigerated. So, and at the time, our daughter was about 11 years old, so we didn't want her to know what daddy was doing. So I had to hide my serum in the very back of the refrigerator. So when those times came when my wife looked at me lovingly and I looked at her lovingly, and that it was that time, I had to run downstairs to the refrigerator, throw all the food out, reach in the very back, pull my serum out, run upstairs, honey, hold on a minute, go in the bathroom, measure out my little measuring needle, and figure out which side did I inject myself the last time. Oh, it didn't matter. So I injected myself, ran back downstairs, threw my serum back in the back of the refrigerator, put all of the food back in the refrigerator, ran back upstairs. And by the time I jumped into the land of paradise, my wife was asleep. So, and then I had those erections, those 5-9 hour erections that were very painful. So I called this place and I says, well, what do I do to get rid of this? I have to go to work. I can't go to work like this and I'm hurting. Well, they told me to sit in a warm bathtub for 30 minutes and take some Sudafed. So I said, well, there's got to be something more to this. I can't keep doing this. So at the time I was changing my primary care doctor, and I asked him, I said, well, I'm at the end of my rope. I'm interested in the penile implant. And so my primary care doctor, wrote me a referral to my urologist, and I was changed to urologist. And so when I met my urologist, I said, hey, look, I'm ready for the implant. I'm ready to go tomorrow. And he says, well, before you make any decisions, he said, you and your wife come to one of our seminars, pre-COVID seminars. And so my wife and I, his testimony, and I was sitting there listening to him, and I was sold right there. I said, this is what I want. I said, the only between this gentleman and myself was I spent thousands of dollars over 6 years trying to correct my erectile dysfunction. And so that same night, I went over to one of my urologist assistants. I made the appointment. A couple of weeks later, I had a pre-operation physical. When they wheeled me into the room for the procedure, I must have been watching the $6 Million Man, because they put me out when they did the procedure. And I kept thinking, like, we can make him better than he was, harder than he was, longer lasting than he was. So I must have been watching the $6 Million Man the night before. So I came, I thought, well, maybe the doctor blanket, and there was an erection staring at me in the face. And mind you, I hadn't had an erection for like 6 years, so I was excited. And so after about my 4 to 6 week waiting period, and after I had my follow-up appointment with my urologist, and when I used it for the first time, after I was finished, those old movies, when the couple was lying in bed smoking cigarettes, that's how I felt. And I don't even smoke, but that's how I felt. It's been a life changer for my wife and I. Not only for me, but for her. Not only do I have to take a jar of pills with me, no longer do I have to sit there and try and use a vacuum pump to try and get an erection. No longer do I have to inject myself. In a matter of seconds, all I got to do is pump that up, and I have a full, firm, hard erection. I just want to encourage anybody who's experiencing erectile dysfunction. Let's not stick our head in the sand like the ostriches. There is some hope for you. Thank you. At this time, I'm going to turn this back to Dr. Taylor, or to Joe, if there's any questions. Once again, my name is John Polson.